BSc Nursing Pharmacology Important Questions 2025/2026. Question 1. Deborah is 45 years old. She has no medical problems. She presents with palpitations. Her EKG shows supraventricular tachycardia at 220 beats per minute. She is hemodynamically stable. The provider orders adenosine 6 mg for push. The nurse administers the adenosine but the patient's rhythm does not change. What is the most likely reason for treatment failure? Option A. The patient has refractory SVT. Option B. The nurse pushed the adenosine too slowly. Option C. The patient needs a higher dose. Option D. The patient has atrial flutter not SVT. The correct answer is option B. The nurse pushed the adenosine too slowly. Adenosine has a half-life of less than 10 seconds. It must be given as a rapid 4 push over 1 to 2 seconds followed immediately by a rapid saline flush. If pushed slowly, the drug is metabolized before reaching the heart. The most common cause of adenosine failure is improper administration technique. The nurse should repeat the dose at 12 mg using rapid push and flush. The patient's SVT will likely convert. Question 2. Earl is 71 years old. He has atrial fibrillation and takes warfarin. His INR is 2.5. He starts taking amiodarone for his arrhythmia. 1 week later his INR is 5.8. He has no bleeding. What is the best action? Option A. Continue warfarin at the same dose. Option B. Reduce warfarin dose by 30 to 50%. Option C. Stop warfarin until INR normalizes. Option D. Give vitamin K 10 mg orally. The correct answer is option B. Reduce warfarin dose by 30 to 50%. Amiodarone inhibits warfarin metabolism, causing the INR to rise. The warfarin dose should be reduced by 30 to 50% when starting amiodarone. Earl does not need vitamin K because he has no bleeding. He does not need to stop warfarin completely. The nurse who fails to anticipate this interaction causes a potentially dangerous INR. Earl needs close monitoring and a dose reduction. His INR will be checked frequently until stable. Question 3. Faith is 77 years old. She has heart failure with reduced ejection fraction and takes metoprolol succinate 150 mg daily. She is admitted for pneumonia. Her heart rate is 54. Her blood pressure is 100/60. The night nurse holds her metoprolol. The morning nurse notes Faith's heart rate is now 102 and her blood pressure is 160/90. What caused Faith's vital sign changes? Option A. Her pneumonia worsened overnight. Option B. Metoprolol withdrawal caused rebound tachycardia and hypertension. Option C. She received albuterol nebulizers. Option D. She had a pulmonary embolism. The correct answer is option B. Metoprolol withdrawal caused rebound tachycardia and hypertension. Abrupt beta blocker withdrawal causes rebound sympathetic activation. Heart rate increases. Blood pressure increases. Myocardial oxygen demand increases. This can trigger heart attack or death. The night nurse made a common error. Faith's heart rate of 54 is therapeutic for heart failure. The morning nurse restarts metoprolol. Faith stabilizes. Beta blockers should never be held for mild bradycardia in patients with heart failure, especially if asymptomatic. Question 4. George is 54 years old. He has hypertension and takes lisinopril 20 mg daily. He develops a dry cough that has persisted for 2 months. He has tried dextromethorphan and honey with no relief. His chest X-ray is normal. He has no fever or shortness of breath. What is the best action? Option A. Continue lisinopril and add a steroid inhaler. Option B. Stop lisinopril and switch to losartan. Option C. Stop lisinopril and switch to amlodipine. Option D. Stop lisinopril and switch to hydrochlorothiazide. The correct answer is option B. Stop lisinopril and switch to losartan. Lisinopril-induced cough is caused by bradykinin accumulation. The cough resolves within days to weeks after stopping the ACE inhibitor. Losartan is an ARB that provides similar cardiovascular benefits without causing cough. Switching to losartan is the best option because it preserves RAAS blockade. Amlodipine and hydrochlorothiazide work but are different classes. The nurse who treats the cough instead of the cause keeps George suffering. His cough is not a mystery. It is the medication. Question 5. Hannah is 42 years old. She is 32 weeks pregnant. She has chronic hypertension and takes labetalol 200 mg twice daily. She presents with a blood pressure of 175/108 and headache. She has no proteinuria. The provider orders 4 hydralazine. Hannah asks why she cannot just take more labetalol. What is the best response? Option A, labetalol does not work for acute hypertension. Option B, 4-hydralazine works faster and is preferred for acute severe hypertension in pregnancy. Option C, labetalol can cause fetal bradycardia at high doses. Option D. Both B and C are correct. The correct answer is option D. Both B and C are correct. Hannah has severe hypertension in pregnancy requiring rapid treatment to prevent maternal stroke. 4-hydralazine and 4-labetalol are both first-line, but high-dose labetalol can cause fetal bradycardia. Hydralazine is often preferred. The nurse explains that Hannah needs hospital admission for medications and close monitoring. Her life and her baby's life depend on rapid blood pressure control. The oral medication at home is not enough. Question 6. Moni is 68 years old. She has heart failure with reduced ejection fraction and takes Entresto or sacubitril valsartan 49 to 51 mg twice daily. She presents with severe dizziness and a blood pressure of 78/48. Her heart rate is 70. Her potassium is 4.1. What is the best initial action? Option A, stop Entresto permanently. Option B, reduce Entresto dose to 24 to 26 mg twice daily. Option C, give 4 fluids and hold Entresto temporarily. Option D, add midodrine to raise blood pressure. The correct answer is option C, give 4 fluids and hold Entresto temporarily. Entresto causes symptomatic hypotension in up to 15% of patients, especially in the first few weeks. The correct approach is 4 fluids and holding Entresto temporarily. Once blood pressure stabilizes, Entresto can be restarted at a lower dose. Permanent discontinuation is rarely necessary. The nurse who stops Entresto permanently denies Imani a life-saving heart failure medication. The hypotension is usually manageable. Question 7. Jerome is 55 years old. He has hypertension and takes lisinopril 20 mg daily. He also takes over-the-counter ibuprofen for knee pain. He presents with weakness, fatigue, and a blood pressure of 160/95. His blood pressure was 125/75 3 months ago. What caused Jerome's blood pressure to rise? Option A, Jerome developed resistant hypertension. Option B, ibuprofen blocked the effect of lisinopril. Option C, Jerome stopped taking his lisinopril. Option D, Jerome has kidney disease. The correct answer is option B. Ibuprofen blocked the effect of lisinopril. NSAIDs like ibuprofen block prostaglandins that help ACE inhibitors dilate blood vessels. The ibuprofen effectively cancelled out Jerome's lisinopril. His blood pressure returned to baseline hypertensive levels. He should switch to acetaminophen for pain. The nurse who fails to ask about over-the-counter medications misses the cause. Jerome's hypertension is not resistant. His ibuprofen is the problem. Question 8. Keisha is 47 years old. She is 30 weeks pregnant. She has chronic hypertension and takes methyldopa 500 mg twice daily. She presents with a blood pressure of 185/115, headache, and visual changes. She has proteinuria. She is diagnosed with preeclampsia with severe features. The provider orders 4 magnesium sulfate. Keisha asks why she needs magnesium. What is the best response? Option A, magnesium lowers your blood pressure. Option B, magnesium prevents seizures in preeclampsia. Option C, magnesium helps your baby's brain development. Option D, magnesium relaxes your uterus. The correct answer is option B, magnesium prevents seizures in preeclampsia. Magnesium sulfate is the standard of care for seizure prophylaxis in preeclampsia with severe features. It reduces the risk of eclampsia by 50%. Keisha's blood pressure is also dangerous, but magnesium is for seizure prevention, not blood pressure. The nurse explains that Keisha needs both magnesium for seizure prevention and 4 antihypertensives for blood pressure control. Question 9. Leroy is 72 years old. He has atrial fibrillation and takes rivaroxaban or Xarelto 20 mg daily. He falls on icy steps and hits his head. He has a 3 cm scalp laceration. He is confused and does not know the date. His blood pressure is 165/95. What is the priority action? Option A, suture the scalp laceration. Option B, order a stat head CT. Option C, give 4 vitamin K. Option D. Observe for 2 hours then reassess. The correct answer is option B. Order a stat head CT. Leroy is on a direct oral anticoagulant with head trauma and altered mental status. He has a high risk of intracranial hemorrhage. A stat head CT is mandatory. Rivaroxaban has no routine reversal agent. If the CT shows bleeding, Andexaw may be needed. The nurse who delays the CT or observes Leroy risks his life. Time is brain. Leroy needs the CT now. Question 10. Mabel is 63 years old. She has hypertension and takes amlodipine 10 mg daily. She presents with swollen, painful, bleeding gums that are growing over her lower teeth. Her dentist wants to perform gum surgery. What is the best response? Option A. Proceed with gum surgery as planned. Option B. Amlodipine causes gingival hyperplasia. Switch to a different antihypertensive first. Option C. Start antibiotics for gum infection. Option D. Refer to a periodontist for evaluation. The correct answer is option B. Amlodipine causes gingival hyperplasia. Switch to a different antihypertensive first. Amlodipine and other calcium channel blockers cause gingival hyperplasia in up to 20% of patients. The gums become swollen, bleed easily, and grow over teeth. The condition is reversible when the drug is stopped. Mabel does not need gum surgery. She needs to switch to a different antihypertensive like lisinopril or losartan. The nurse who fails to recognize this side effect sends Mabel for unnecessary surgery. Question 11. Nathan is 50 years old. He has no medical problems. He presents for a routine physical. His blood pressure is 145/92. His BMI is 27. He exercises 3 times per week. He eats a balanced diet. He drinks 2 beers per week. He does not smoke. What is the most appropriate next step? Option A. Start lisinopril 10 mg daily. Option B. Repeat blood pressure in 1 to 4 weeks. Option C. Start hydrochlorothiazide 12.5 mg daily. Option D. Start amlodipine 5 mg daily. The correct answer is option B. Repeat blood pressure in 1 to 4 weeks. Nathan has a single elevated reading. The diagnosis requires elevated readings on 2 or more occasions. His lifestyle is already excellent. He needs a repeat blood pressure measurement in 1 to 4 weeks before starting medication. The nurse who starts medication today makes a diagnosis on insufficient data. Nathan may not have sustained hypertension. White coat effect is possible. Repeat measurement is the standard of care. Question 12. Opal is 76 years old. She has heart failure with preserved ejection fraction and takes furosemide 80 mg daily. She presents with sudden onset of hearing loss and tinnitus in her right ear. Her furosemide dose was increased from 40 to 80 mg 2 weeks ago. She has no ear pain. What is the most likely cause? Option A. Age-related hearing loss. Option B. Furosemide caused ototoxicity. Option C. Meniere disease. Option D. Acoustic neuroma. The correct answer is option B. Furosemide caused ototoxicity. Loop diuretics like furosemide cause ototoxicity, including hearing loss and tinnitus. The risk is dose-dependent. Opal's symptoms started after a dose increase. The hearing loss may be reversible if the furosemide is reduced or stopped. She needs an audiogram and a switch to a different diuretic if possible. The nurse who dismisses this as age-related misses a preventable drug side effect. Question 13. Paul is 58 years old. He has hypertension and takes hydrochlorothiazide 25 mg daily. He presents with severe weakness and muscle cramps. His potassium is 2.7. His magnesium is 1.4. His EKG shows prominent U waves. What is the priority intervention? Option A. Stop hydrochlorothiazide and give 4 potassium. Option B. Give 4 magnesium first then 4 potassium. Option C. Give oral potassium supplements. Option D. Give 4 calcium gluconate. The correct answer is option A. Stop hydrochlorothiazide and give 4 potassium. Thiazide diuretics cause potassium and magnesium wasting. Severe hypokalemia with U waves puts Paul at risk for Torsades de points. For potassium is the priority. Magnesium should also be replete, but potassium comes first. The nurse who gives magnesium alone does not fix the hypokalemia. Hydrochlorothiazide must be stopped or changed. Paul needs cardiac monitoring during repletion. Question 14. Quincy is 69 years old. He has atrial fibrillation and takes warfarin. His INR is 2.7. He starts taking amiodarone for his arrhythmia. The nurse knows that when amiodarone is added, the warfarin dose should be reduced by what percentage? Option A 10 to 20%, option B 30 to 50%, option C 50 to 70%, option D no reduction needed. The correct answer is option B 30 to 50%. Amiodarone inhibits the metabolism of warfarin by competing for CYP2C9 and CYP1A2 enzymes. The interaction causes the INR to rise by 30 to 50%. The warfarin dose should be reduced by 30 to 50% when starting amiodarone. The nurse who fails to anticipate this interaction causes a potentially dangerous INR. Quincy needs close monitoring and a dose reduction. Question 15. Ramona is 41 years old. She is 28 weeks pregnant. She has chronic hypertension and takes labetalol 200 mg twice daily. She presents with a blood pressure of 178/110, headache, and epigastric pain. She has proteinuria. She is diagnosed with preeclampsia with severe features. The provider orders 4 hydralazine. Ramona asks why she needs 4 medication. What is the best response? Option A, oral labetalol works too slowly for severe hypertension. Option B, 4 hydralazine lowers blood pressure within minutes to prevent stroke. Option C, high-dose labetalol can cause fetal bradycardia. Option D, all of the above. The correct answer is option D, all of the above. Ramona has severe hypertension and pregnancy requiring rapid treatment to prevent maternal stroke and seizure. Oral labetalol takes hours to peak. 4 hydralazine works within minutes. High-dose labetalol can cross the placenta and cause fetal bradycardia. The nurse explains that Ramona needs hospital admission for medications and close monitoring. Her life and her baby's life depend on rapid blood pressure control. Question 16. Sydney is 52 years old. He has coronary artery disease and takes clopidogrel or Plavix 75 mg daily. He had a drug-eluting stent placed 11 months ago. He needs a colonoscopy with polypectomy. The gastroenterologist wants to stop clopidogrel for 7 days before the procedure. What is the best action? Option A, stop clopidogrel as ordered. Option B, continue clopidogrel because stopping causes high risk of stent thrombosis. Option C, stop clopidogrel for 3 days only. Option D, switch clopidogrel to aspirin alone. The correct answer is option B. Continue clopidogrel because stopping causes high risk of stent thrombosis. Sydney is within 12 months of his drug-eluting stent. Stopping clopidogrel carries a 30 to 50% risk of stent thrombosis, which has a 40% death rate. The colonoscopy with polypectomy can be delayed until Sydney completes 12 months of dual antiplatelet therapy. The gastroenterologist is unaware of the stent. The nurse must advocate for Sydney. His heart is more important than his colon. Question 17. Tamara is 65 years old. She has hypertension and takes lisinopril 20 mg daily. She also takes lithium for bipolar disorder. Her lithium level has been stable at 0.7 for 3 years. She presents with confusion, ataxia, and dysarthria. Her lithium level is 2.4. What caused Tamara's lithium toxicity? Option A, lisinopril decreased lithium excretion. Option B, Tamara took extra lithium. Option C, Tamara has acute kidney injury. Option D, lisinopril increased lithium absorption. The correct answer is option A, lisinopril decreased lithium excretion. ACE inhibitors like lisinopril decrease glomerular filtration rate and increase lithium reabsorption in the proximal tubule. The result is lithium accumulation and toxicity. Tamara's lithium level rose from 0.7 to 2.4 within weeks of starting lisinopril. She needs 4 fluids and possibly dialysis. Lisinopril must be stopped and replaced with a different antihypertensive like amlodipine which does not interact with lithium. Question 18. Ursula is 78 years old. She has atrial fibrillation and takes apazaban or Eliquis 5 mg twice daily. She falls in her bedroom and hits her head on the nightstand. She has a 1 cm scalp laceration. She is alert and oriented. Her neurological exam is normal. The emergency physician wants to discharge her after suturing her scalp. What should the nurse do? Option A, discharge Ursula as ordered. Option B, insist on a head CT before discharge. Option C, give Ursula a head injury instruction sheet and send her home. Option D, call Ursula's son to pick her up. The correct answer is option B, insist on a head CT before discharge. Ursula is on a direct oral anticoagulant. She hit her head. Intracranial bleeding can occur without early symptoms. A head CT is mandatory regardless of her normal exam. The physician is wrong. The nurse must advocate for the CT scan. Isola's life depends on it. The CT may show a subdural hematoma that requires reversal and neurosurgery.